Hello, everybody. We're back for another episode of Taking Care of Business. My name is Mike Katz. I'm the Executive Vice President of T-Mobile for Business. And today, I am really thrilled to be joined by Jim Tougas, who is the CEO of HomeMD Housecall Services. Now, HomeMD Housecall Services is a small business. They're based in Howell, Michigan, and they deliver in-house clinical services to more than 1,300 elderly patients who are either homebound or in assisted living. So Jim, thank you so much for being here. I really appreciate it. First place I wanted to go is obviously with what's going on with COVID right now. Everybody knows how disproportionately impacted elderly have been.
Sure.
How has your business changed post-COVID with the impacts that I'm sure your patient groups had with this horrible disease?
How hasn't it changed? Really everything we do, has really changed. We've gone a significant amount towards being telephonic now that we're able to do that. Medicare lifted restrictions on that in light of the COVID crisis. So we've deployed tablets out to I think we've got about 400 or 500 of them out in the field right now, and we've got another 500 or 600 of them that we're working on. I'm currently surrounded by tablets all over my office right now. They're everywhere. So we're getting those out to our patients because the elderly, they have a difficult time managing their iPhone or their Android phone or their tablet if they should have one, and most of them don't. So we need to be able to kind of reduce the complicated nature of these devices for them. So we're able to kind of scrap almost everything other than the software that we need. We put those on the tablets and then we send them out. And then we don't have to worry about things like Wi-Fi connectivity and things along those lines because we've got the T-Mobile network backing the whole thing. So it kind of streamlines the whole thing. We know that when we send a device out to them, we're going to be connected. It allows them to be able to reach us. Really, it used to take us 2, 3, 4 days sometimes to get into a patient's home if they were having a medical problem, to get them the medications they need or whatever it might be to resolve that problem. And now we're able to get in there, literally within minutes. And these elderly folks, they're not like you and I where we have a problem and we can sit on it and wait a couple days. Within a couple days, they may be in the ICU. So it's imperative that we get these things cracking and get it going very quickly. And we're able to do that with all these tablets that we have out there. So that's been one way that's been the primary way that things have really changed. We're no longer, because we do so many assisted livings, we're in about 80 or 90 assisted livings throughout the state of Michigan. Most of these assisted livings locked down a few months ago to where they don't want any medical providers or anybody else in their buildings. Every time somebody walks in their building, they're risking exposure. And all it takes is one of their residents or one of their workers to be exposed to catch the COVID-19 thing. And then we end up melting down in their entire building. So we're able to kind of get behind enemy lines with these tablets. And that has helped quite significantly.
So pre-COVID, your interactions were physically in front of each of the patients?
Absolutely. Okay. Yep. We would drive out to their home or drive out to the assisted living facility and be right there with them, face to face with them.
And is it now 100% virtual?
No, I'd say about 50-50 at this point. But we're able to do things that we could never do before. At 8 o'clock at night, if our patient's having, some kind of an issue, the assisted living facility coordinator or nurse or the patient's daughter or the patient themselves, if they're able to operate the tablet. And in most cases in the independent facilities and in the residential homes, they're able to do that. We're able to reach out to them at 8, 9 o'clock at night and really they kind of have a virtual urgent care in their back pocket pretty much all day, every day now, which is pretty awesome. So.
Yeah. So this transition from, really kind of physical interactions and your job being physically in front of your customers, your patients, to, at least a big portion of it being virtual. There's a version of that I think a lot of businesses are going, like at least contemplating right now or attempting to go through. As you guys have done it, what have been some of the things that have made that transition successful for you that, that could be good advice to other businesses that are considering it?
For us, it's been understanding our consumer, understanding what their limitations are, and then meeting them halfway or all the way in when we need to, and getting the device to them, making it so that it's very difficult to not be able to operate it. Those kinds of things. Those were our primary challenges. Trying to morph into a company that's doing inventory management and things along those lines with different devices, and our remote monitoring blood pressure cuffs and our remote monitoring scales and things along those lines. It's been a little bit different. And then our nurse practitioners who are used to being able to listen, to somebody's lungs with a stethoscope, having to tinker with our chart notes to support, visual observations as opposed to, using our ears, and really becoming a company that's able to coordinate care across all the other resources that are out there, the home health care companies, the medical equipment companies, the mobile diagnostic companies. Being able to really coordinate that care is really what we've really become accustomed to doing, as opposed to delivering it ourselves in a lot of the cases.
Yeah. So as you guys have gone through this change, what's the feedback from your patients been, and as well as from your employees? Because this is a big change for both of them, and how they handled it, and what would they say about it right now?
Yeah, it's been a huge change, and it was pretty terrifying because I didn't know it was the only way that we could get to these folks and take care of them, and I didn't know what it would end up, what the outcome would be, if they would like it, if my nurse practitioners, if they would like it. But overall, the feedback has been not just good, it has been incredibly good. The elderly have done very, very well with these devices. They're able to use them. The nurse practitioners are really able to get through their visits and diagnose and treat more patients during the span of a single day without nearly as much in terms of distractions, traffic and things along those lines that they don't have to deal with anymore. They're able to hang out at home and take care of their kids while they are providing medical care, which is great for family balance. So overall, it's really, really made us much more powerful in our ability to deliver quality care, and I think our consumers realize that. I think they see that.
Your customers, you mentioned this is a group of people that may not have in their personal lives adopted some of this technology. Like how have you helped them make that transition so that this to make this whole process so successful?
Yeah, I mean, I'll tell you, some of our patients were around during the last pandemic in 1918. So they've been around for a while, and a lot of them have never ever interacted with a cell phone or anything like that. And they've got other people who manage those things for them, and some of the memory care units and assisted living facilities. So interacting with their families and whatnot has made that a little bit easier. Having family support, they're able to go in and help mom with the tablet until she's able to kind of get an idea how to use it. Really, we haven't set it up so that they are contacting us using any of these devices. They're still contacting us to report their issue with a phone, and then we dial in, and all they have to do is answer the thing. So that way we can do a video encounter, because that's what we need to be able to do to be able to bill their insurance. So.
Has it changed at all the way that you go and find new patients? Like, has it helped or hurt the way that you go and acquire new patients into your service?
It's changed it 100%. Everything. Like I said, everything's different now. I mean, a day is like a month, in terms of everything changing. How fast everything's changing in medicine, particularly surrounding this whole COVID crisis. So yeah, it's changed a lot in terms of how we market. We're marketing accessibility to care and availability to care now, as opposed to the smiley face that somebody's going to have the bubbly personality when somebody pulls into your driveway with a stethoscope on. So now we're really marketing to the assisted living facilities themselves, and then to home healthcare companies, skilled care nursing companies. They provide some of the private duty companies. We're marketing directly to them to show them how we can help their business by keeping folks out of the hospital, their clients out of the hospital, and what that does for them and their businesses. So it's become our customer has really become the other businesses that are entrusted with these folks' lives, while our consumer has become the patient. So it's made things a little bit different in a good way.
Yeah. Has it caused you at all to think differently or start acting differently in terms of where you provide services? Because I imagine in your pre-COVID model where you're physically going out and meeting with patients, you're a little bit probably geographically bound based on how far your providers could go out. Like, can you think differently now about where you do business because of this?
Yeah, incredibly. I mean, we're talking about taking on some patients out in Colorado. We're talking about Texas. We no longer have to really factor in so much the geography in terms of which provider we assign to which patient. Not nearly as much anymore anyway. It used to be that we would need, I don't know, maybe 10 providers to just kind of sprinkled in certain locations throughout Michigan. Rather than hiring the best provider, maybe I would need to hire the best provider in a particular area. Whereas now I can just hire the best of the best, and they can provide care from anywhere to anywhere. So yeah, that's been a huge difference. It's really the secret sauce in doing house calls really was, how do you manage the logistics of geography? And no longer do we have to deal with that at all. So
yeah. It's also interesting to think about if you're physically putting tablets and connectivity into the hands of these patients, what other services could you potentially provide to them? Especially a group of people that sometimes can feel a little bit isolated. It'd be really, I don't know if you've thought about that at all, but I'd be really interested to hear about other services that you could provide.
I'll tell you, we have on every one of our tablets, we've got connections to the Michigan Health Exchange. So these patients are able to get, and their family members are able to get access to their healthcare records all over, from anywhere. And they're able to do that with these tablets. Right, it becomes a portal. These patients are able to get. We're figuring that at some point in time we'll be hooking up with specialists. So we'll be able to have a cardiologist on staff, a pulmonologist, an endocrinologist, and have them available to consult. And we would have the daughter, the patient, our provider, and whoever's consulting all on the same phone call. We have apps that we're looking into right now for wound care, where somebody could take a picture of their wound and it would beam over to us. And the wound care supplies would be ordered automatically through it, which is pretty incredible. Our remote monitoring devices, so our blood pressure cuffs, our scales, they're taking those readings and then sending those readings to the device. The device then beams them up to us through the cloud. Physical therapy, we're looking into providing physical therapy telephonically. So it's pretty incredible what's out there. Pill reminders. I mean, it's we haven't even scratched the surface yet on what we're able to do with these things.
Yeah. I mean, do you think that COVID almost acted as a forcing function to push you in this industry, like where it would have gone eventually, just over a shorter period of time? It was back in the end of October 2019. There was a act that I think it was the Connect with Care Act was sailing through Congress. I believe it was unanimously voted up in the House, and then ran into some congressional budget issue in the Senate. But outside of that, it would have gone through, and that would have enabled telehealth technology. It would have opened the door to that, just like what we have right now. Once the COVID crisis hit, it gave them no excuse, no reason to not just let that out of the box. And
So we've been in telephonics. We haven't been able to bill it out really until now. But we've been dabbling in it for about a year and a half, really trying to kind of tinker with it, get used to it. And that way, when at which point in time Congress green lighted it, we'd be able to deploy it and hopefully at that point be well ahead of competition. And then this all hit. And I would say it probably fast forwarded this kind of technology by at least a couple of years. Any lobbyists that were out there trying to slow it down, they were moved aside, and now it's full bore telephonics and medicine. So,
well, I'm sure your patients are extraordinarily happy for that, especially in this environment. When you think about, eventually, like hopefully, cross your fingers, we'll be out of this COVID world, and we'll be back to some new normal. And when you think about what's happened over these last weeks and months, as your business has evolved and changed, and you're serving your customers and patients in a different way, how does it change your business in the future? Like, do you guys go back to what you're doing before, or what's your new normal?
I think we're going to find out what our new normal is when new normal happens. But we're kind of thinking about that a little bit. We don't want to be a fully telephonics company, but we want to be able to utilize the tools that we now have available to us that we never had before. So probably what we're thinking about is we'll end up having on-site visits, maybe every few months, and then, augment those with, typically we see patients monthly, and then also whenever they have problems in between those monthly visits. So maybe every few months we'll do the on-site thing, and then telephonic visits in between, which will be great. Our NPs will be able to see more patients in less time and provide a higher level of care and hopefully reduce hospitalizations across the board, which I think is what we're going to find here. But I think that our new normal is going to be, I think we're playing in our new normal right now. And I don't think this genie in terms of medicine is never going back in the bottle, ever.
Yeah. Well, in this case, it sounds like that's a good thing, because it sounds like the level of care that you're able to provide is far better than what anybody was able to do before. So thank you, Jim. Thank you so much for sharing your story. I think
thank you, Mike.
What you and your company are doing are just so incredible, and it's having such a big impact. I know to the 1,300 patients that you're serving today, future patients that you're going to bring on, and in these communities, and to the families as well. Because I know all of us, as COVID hit, one of the first areas that we all think about are elderly relatives, and are they safe, and are they being taken care of? So thank you so much for what you and your company are doing with that. I think whether it's COVID-19 or not, the work that you're doing is really, really important. So thank you so much. And for everybody out there listening, one thing that I really would love to encourage with everybody is find ways to support your small businesses in your community. They are the lifeblood of our economy. They're the backbone of our communities. Please find a way, go out of your way to support them. Thank you very much. And T-Mobile for Business, you have our commitment that we'll continue to do the same through great content and great support programs for our small businesses. So thank you, Jim. I really, really appreciate it. Keep doing great work.
Thank you, Mike. I appreciate it. And we appreciate all the support we've gotten from T-Mobile. It's been, the customer service has been nothing but outstanding. And our marketing rep has really empowered us and made us able to scale. He's practically become a part of our company. It's just been, we couldn't have done it without T-Mobile, really. We wouldn't have been able to do it.
Yeah. Well, thank you. We couldn't do it without incredible customers like you. And so thank you again for all the work that you're doing.
Absolutely.